Hello, my name is Scot Ackerman, and I'm a radiation oncologist here in Jacksonville, Florida. I see lots of patients with cancer, and I see a lot of patients with colorectal cancer. People ask me about colorectal cancer. They hear the term colorectal cancer, and they want to know what it is. Well, colorectal cancer is cancer of the colon and cancer of the rectum. And it may seem like one big organ, but really we divide it because the treatments for colon cancer are a little different than the treatment for rectal cancer. But the real question that comes up is, how can I prevent, or what can I do to minimize my risk of getting colorectal cancer? What can I do to make sure that I don't die of colorectal cancer? And what you could do is get a colonoscopy. And what I recommend is that once you reach the age of 50, you get a baseline colonoscopy. A colonoscopy is done by a gastroenterologist who looks through the colon with a scope. It's an uncomfortable procedure, but usually you're put out, you're asleep, so it's not so uncomfortable. They tell me the prep, actually they don't tell me, I know firsthand that the prep is worse than the procedure. But what the colonoscopy does is it's able to do two things. One, identify colon cancers or rectal tumors when they're caught early, in a stage where they can be cured more readily. And number two, and this is very interesting, we're able to see benign polyps that are premalignant. And they can be removed during time of colonoscopy, and this actually prevents colon cancer. And if you look at populations that have a colonoscopy on a regular basis compared to those that don't, those that have a colonoscopy on a regular basis have less colon cancers, not just die less, but have less colon cancers because of the colonoscopies. So the colonoscopy can prevent a colon cancer from forming. It prevents it by removing benign tumors before they have the chance to de-differentiate and become malignant. So if you have any question about colon cancer or rectal cancer or the diagnosis and treatment of it, please feel free to call me. My name is Scot Ackerman. I'm a radiation oncologist in Jacksonville, Florida. My phone number is 904-880-5522, or I can be reached on the web at www.firstcoastoncology.com.